Okay, so this is what I dub isometric counter stretching. So uh, there are certain techniques in massage that you're going to feel when a pressure point is activated with pressure, and you have the person flex into that and hold it for a time and then release, and it actually releases more. So we're going to do the same here with her body. So we're looking at getting a wider range of motion. You can see that there's people generally have a lot of stiffness in here, or they have stiffness going back, or they have stiffness going here, meaning if I start turning this, she rounds her body forward to compensate for the pressure rather than has the flexibility for, there we go, that. So what I'm going to do is on this one, I'm going to place my hand, so if you take a look over here where the joint is, so you'll feel where the muscle comes into play. And this is your pivot point, basically. And you can do it two different ways. One is you can just counter this way or this way, depending on which hand you have for preference. The other thing is I'm going to be finding a line of tension. So when we use Rebel Wing Chun, it's the same type of sensitivity that you would feel with pressure and direction. So if she's doing her best to relax and I still get that tension, that informs me of this line of tension of where the muscles are tight and range of motion is definitely a problem. So one thing you want to do is not go past points where you could tear something, because you definitely don't want to mess with the rotator cuff area. So what I'm going to do is where I feel that line of tension. So if I feel a line of tension that's like pulling down here, I'm going to take that pathway and I'm going to drive up toward it. She's going to take her elbow at this point that's touching my hand, feed it back to me in this line. And what I'm going to do here on this is I'm going to pull this in at the same time as I'm pushing upward. So I'm going to do that, and I'm going to have her pull. So she's going to isometric control it. So pressure into my hand here. And you may change the position, like how I'm angling right now. So you're going to pull down, keep consistent pressure. Yep. So you'll breathe through it anywhere from 5 to 10 seconds or so, and then have them relax, and you'll feel the tension go, and you'll feel that they have more range of motion right off the bat. So have their tense up again, pushing directly in the right line, and then I'll counter with this pressure, and we're going to hold that isometric. Going to go a little longer this time. Press into my hand. Yep. And release. Now, some people may not be able to hold for that long. You can see already the range of motion she's gotten from when we started. The lack of tension here is dramatic. So that's what you want to do. So the same thing here. When we're doing it from this position, she's got a couple of different ones that we're going to work with. So when I do this, and this pulls, what that means are the connecting muscles are so tight it's drawing her shoulder forward. So because we train for fighting and because we train for really extensive wide range motion and some of the oddest motion you'll encounter, there's a couple of ones that we're going to deal with here. One is going up like this, but also this way right now. So keeping her in this position, I'm going to press forward here and then push here. So I'm going to go like this, and she's going to push back here, and then she's going to take her hand and push that way. So she's actually doing two different angles of pressure for her isometric control. I'm going to go here, she's going to push into my hand, driving her elbow back to my elbow here. If she needs to look, she'll look at it. She'll press the hand forward as if going straight in an arc in front of her. She'll hold that, and release. Already it's a dramatic release. Okay. So movement, relax. And she'll hold her tension again. Push the hand to forward, and back. Pressure. Hold it. Consistent. And release. Big difference. Look at how far her arm is bending now. She couldn't do that without moving that whole body. You can feel the tension level is reduced dramatically. So here's one that you'll see people do, but we're gonna isometrically control it. Typically I'll put my knee up here because sometimes I want to get the shoulders back like that. Sometimes I'll go here and I'll put my hands back here and then place my palms up high. I don't want to go down here. I want to go up here. And what she's going to do is she's going to feel the ridge of my forearm in here, and she's going to press so that she feels that pushing into my arm. She's going to press as if going in an arc like that. So, same practice. I'm not going to go beyond her comfort zone just to get to where she's about at her end range of motion right now. Now she goes and holds the tension. Press into me on both sides. Think of bringing that arc around. Hold that tension, hold that tension. And release. Okay. And do it again. And push into my forearms really, really tight. Both sides as if you're going to bring them around to the front. Push out with those elbows. Your elbows have to do the work. There we go. I'll feel the pressure on the bone. And release. There. So you can see how it dropped in already. Okay? So she's already got more of a range of motion than what she had before. Now she's got some good tension here too. So, okay. So what I'm going to have her do is she's going to go as if drawing down here. And I'm going to counter. I'm going to push down here as I push up there. She's going to take it like she's drawing there. Holds the tension. And release. Okay. So I'm going to change the angle a little bit because of how I feel where the line of tension is. I'm going to go back that way a little bit more. She's going to draw forward at the counter. Okay. And tense. Bring your hands up a little higher. There you go. Now, there you go. As you'll feel the whole line of tension through that center point that you're making. Tense, 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 tense. Breathe through it through your nose. And exhale and relax. There you go. It's a big difference. The amount of pressure that I had to hold that up there was reduced a lot. Now we had one guy when I was doing that, he felt nauseated at the end of this. There's a lot going on when you hold tension like that and then increase that range of motion. There's a lot breaking up. So you have to think about being nice to your partner and that might be one of the outcomes. Going to do the same thing here. She's going to put her hands in an arc like that and go ahead, tension. If they're really strong, you might have to brace your elbows against your body, that sort of thing. And I'm going to subtly change where I feel that tension. There we go. Hold it, hold it. So they have to maintain this as tight as possible. Consistent tension, 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 relax. There you go. Oh, big difference. Big difference. Huge difference. Ah. Okay, so here we're going to open this up. So when we open that up, that means the chest muscles that generally pulling in the pec muscles are generally pulling like that. So they're two different things. They might be really strong and very dense and just not enough flexibility, meaning when you're doing weights and so forth, you don't add in stretching, which you should always do, and get that wide range of motion. A lot of people do short stroke movements, so they get just a pump, but their muscles, they can barely flex their arms, which means in a fight you can tear joints and tear muscle pretty easily. I won't say anymore, but it can happen. So what I'm going to do here on this point, depending on their height, I may have to be up on a counter. So I have to be careful where the spine is. So my pressure is going to be along the full length here. And I'm drawing in like this. I'm curling in like this, and what she's going to do is she's going to try to round herself forward more. That's where she's going to hold the tension. So other ways of doing this is if I can put a pad here and just, set that on top of there, depending on, I train my head a lot, so I'm going to go like this, gentle pressure at the spine, so I have enough surface area, so I can go here. I'm just going to pull and hold, okay, and she's going to do the work. There we go. Just round the shoulders, feel them pushing into my fingers. Push into my fingers more. There we go. That's all. So I'm basically like, she's up against the wall. I'm not pressing hard on her spine or anything. She's just doing all the work. Hold that tension, and relax. Oh, it's already opened up. You can feel the difference between the tension level that I had earlier to where I have now. Okay, so just gonna hold tension again. Squeeze those shoulders into my fingertips.
Isolate my shoulder there.
Yep. Push them into my fingertips. So that's how she can guide that, is she's got to feel pushing against the tips of my fingers, because I'm curling them in so she can find the right angle. Hold that tension, hold that tension. That sometimes is hard for people to do if they haven't done this a lot. They can't hold the tension for very long. She's trained, she's strong, anybody that I train, they end up being really strong so they can hold it for longer. And release. Oh, big difference. Big difference in how much she opened up. It's dramatic, especially when you're feeling it. I'm not doing anything where I'm forcing and cranking and tearing. I'm holding a counter stretch position that she has to isometrically pressure into and hold, and then release, and all of a sudden you get that range of motion. How does that feel?
Much better, yeah.
Yeah.
Your things crunching.
Yeah. Cool. So, and that can be done with your head. Like if I'm looking into my side like this, you can do this by yourself. So if I can't turn very far like this, what I'll do is I'll hold my hand against my head and I'll push myself into my hand and I'll hold that tension, hold that tension, and relax. And then now all of a sudden I can turn more. So be careful with the neck. You don't want to press so hard. This can be done with just about any muscle group, any joint. So you just have to find lines of tension. So wherever there happens to be a line of tension. So if we have a line of tension here, right now, not being able to get that arm up really high without a lot of... That one. This one actually has more range of motion.
Feel tighter.
Yeah, this one's tighter. So, and I know by how much resistance I'm feeling. So I'm going to feel where that line of resistance is. Right there. Then I'm going to have her take her right where my hand is contacting, and she's going to go like right down this elbow with her pressure. She's going to go right, try to drive her elbow down into my elbow. You have to do straight lines and arcs and make sure that they follow these paths properly, because they're lines of resistance that work the muscle in that range of motion. And relax. There, it's already. It's dramatic. When you do this to people, it's dramatic. Not traumatic. It could be if you're doing it wrong. Dramatic. So same thing here. For some people it's different. I may have to now, it's not straight up pressure, but I have to go in at this angle because that's where I feel the tension, the line of tension. So that means she has to do a counter. She has to go as if that line of tension is going to go there. She's going to press. Sometimes I'll use my elbows so they can guide along the forearm. I'm going to counter here and tension, go. Hold the tension, bring your elbow right down to my elbow. There we go. In that line. Hold. Tense it up, tense it up. And some people may take a long time. You may have to do several sessions like this. And release. But look at that range of motion. It's dramatic, and it helps people a lot. Yeah.
It's been honestly big since like
Yeah. So she's an artist. So she does 6 to 8 hours of drawing in certain positions. You sometimes remember to move, but you don't always get to. So she'll have tension in that arm at different lines because that's the drawing arm. So, but as you saw, she had this. I was surprised she couldn't move her arm like that with that range of motion before. So this will help. So again, you're not forcing hard. You're finding the line of tension and going up to where it's pretty tense, countering the pressure, having them go in a line that feeds that tension. They're going to feed right down the line of tension, and you're going to set your arm properly, because sometimes you may have to position it so that they can have a visual for where to actually strike. They can have a visual for where they actually have to drive that line, and then you're going to hold tension as they drive tension in that line. You're always thinking lines of motion. They have to do these particular lines for where they're tense. There's even in this. So I'm doing it this way. It's an arc up this way. It's an arc back that way. They have to do that depending on where I need it. It could be just straight up. It could be a straight line like that. So it works. It's really dramatic on people. They all of a sudden have freedom of movement and things like that, and it doesn't require much. But don't go past somebody's line of tension. Don't push into something where it's painful. Tons of caveats. So if you don't know what you're doing, have a massage therapist do it, or contact me for some training, because we're going to teach everybody here how to do that. Okay?